2-2! The world over, attention is focused on the 2014 World Cup. Who is still in, who is out, and who just might make it home with a trophy after the two final teams tussle it out. But away from getting to the finals, all the 32 countries in the World Cup have fared better in scoring against bad health amongst the children, especially reducing the under-5 mortality. A World Cup scorecard, keeping tabs on the countries that have been involved in the World Cup since the 1990 Games in Italy, released from the Global Health Strategy, looks at how these represented countries have been faring in terms of child mortality.
So the scorecard was a way to show, do something fun and to show something important in a fun way, and try to get people's attention, and I think we succeeded in that.
Brazil comes top of the best performing countries.
From 1990 to 2014 have had around 77% decline, which is very good, and is one of the countries that will reach the goal that we set out in 2000, which was that the Millennium Development Goals said that we want to try to reduce child mortality by 2/3.
Other World Cup countries include Portugal, having reduced from 15 of every 1,000 live births in 1990 to 4 this year, a percentage increment of 76. Iran comes in third with reduction from 56 deaths of every 1,000 births to 18, tying with Uruguay at 69% reduction of the deaths. The last in the top 10 is Italy, the 1990 host, having reduced from 10 deaths of every 1,000 live births to 4 today.
Immunization, they have focused on their health system and also some political commitments.
There are strategies countries can use, focusing mainly on proven interventions like code of care when children are born and family planning. The card shows that in Brazil, the national immunization program increased immunization rates amongst children, and the national breastfeeding policy more than quadrupled breastfeeding. Lee, the WHO economist, says there are other ways too.
Having children in school, that females are able to participate in the labor force. And one interesting one is that countries with higher female political participation rates are also doing well. And of course, water hygiene and sanitation.
The scorecard shows that those countries that stand out have gotten their priorities right.
They are focusing on a few things and push that forward.
The bottom 10 include England with a reduction from 9 to 5 in every 1,000 live births. Ghana comes in 5th with 128 of every 1,000 live babies who used to die in 1990, reducing to 72. At the very bottom is Côte d'Ivoire with only a 29% reduction. The scorecard pulls out Nigeria doing particularly badly with 124 babies of every 1,000 born expected to die.
What you will find that in those states, which really are the ones that have challenges, we need to build the health system, we need to provide more human resources for health, we need to provide greater access to women, provide money for them to be able to access the services, because it's okay to put up all these things, but if they can't afford it, then there is a problem. And build the service close to communities so that they don't have to travel long distances.
England in the bottom 10 is doing much better than all African countries. So why is it on the list?
Some of these countries were already doing well in 1990, so it's hard to, going from 2 to 1 is very hard. But going from 60 to 5 is easier, for example. So that's the reason. So it's a fun way to show something.
The 2014 World Cup scorecard has been released in the run-up to the Partnership for Maternal, Newborn and Child Health in Johannesburg, South Africa, which looks to reduce maternal and child mortality by scaling up simple interventions that can be used by any country, even the resource-limited ones. Florence Naluyimba, NTV in Johannesburg, South Africa.